Subscribe to Omya Fertility and press the bell icon to never miss an update.
So, मेरा पहला सवाल डॉक्टर सीमा आपको ये है कि a lot of couples don't even consider diseases like PCOS, endometriosis, adenomyosis, cystic fibrosis, etc. as a cause of infertility until they consult a fertility expert after trying to conceive for months on their own. So, let's start with the basics. What kind of hormonal or ovarian diseases actually affect fertility?
First of all, I would like to say that fertility can affect both male and females.
Right.
So hormones males में भी होते हैं, females में भी होते हैं, and it can affect your fertility. Females में जब hormones affect होते हैं तो they cause you ovulation disorder, जिसमें क्या होगा कि most important is polycystic ovarian syndrome या polycystic ovarian disease होती है, या endometriosis होता है, या hyperprolactinemia होता है कि आपका prolactin level rise हो जाता है, जो कि आपकी fertility को affect करता है. Secondly, what is important is thyroid disorders also. So these are the hormonal disorders. Thyroid में या तो hyperthyroidism हो जाएगा या hypothyroidism हो जाएगा.
Right.
So these are the type of disorders can affect your fertility because of ovarian dysfunction. Other diseases, something like the uterus also can be affected with your hormonal disorders. कि आपकी lining बहुत endometrium thick हो गई या thin हो गई. So this also can affect your fertility. Same way, it can affect male fertility also. So males may, if the hormones are disbalanced, so the sperm count, sperm number, quality, all decreases. So we should understand that hormones affect both male and female. So you cannot blame only females for the hormonal disorders.
Very rightly put, and I'm so glad you put it this way because kai bari females are the ones who are the victims of all the blame. Now, considering that we are especially talking about PCOS, endometriosis, reports suggest that 1 in 10 females could have PCOS, a disease or a disorder which is slated as the main cause of infertility. Could you describe to us what PCOS is and how it is caused? Also, what is the difference between PCOS and PCOD?
So this is a very rightly put question. So a lot of patients get confused what is PCOS and what is PCOD. So both are the hormonal disorders. PCOS is polycystic ovarian syndrome and PCOD is polycystic ovarian disease. So PCOS is a systematic disease, a metabolic disorder, and PCOD is a symptom of that. In a case of a PCOD, only the ovaries become dysfunction, but in a PCOS, whole of the body or the metabolic disorders occurs. So this is important to understand. PCOD में क्या होगा कि your period become irregular, but you can conceive sometimes naturally. PCOS is a more serious disease. You will have more systematic disorders, like you can have more diabetes, you have chances of diabetes, hypertension, cardiac disorders.
Right.
So both are the hormonal disorders, but severity of PCOS is more.
But how does it cause the infertility? If you could just explain that to us.
Yeah, I'll tell you that what happens. Both of them, your ovaries may, every month, an egg is formed with ruptures on day 14 and the fertilization occurs. So, PCOD mein ya PCOS mein, your hormones become imbalanced. Your ovaries produce a hormone which is known as estrogen and a small amount of androgens. So, PCOD mein kya hoga ki your androgen level increases. Your follicle doesn't rupture, your ovary size increases in size, and there are a lot of small follicles which are known as cyst formation occurs. So this causes a hormonal disorder. Because of this, you gain weight, your cycles become irregular, there can be acne, there can be thinning of your hairs, there can be obesity. These are the symptoms of PCOD and PCOS. So मेन हमें सबसे इम्पोर्टेंट है समझना कि इससे क्या होगा कि आपके हार्मोन्स डिसबैलेंस हो जाएंगे जिसकी वजह से ओवुलेशन नहीं होता. द मोस्ट इम्पोर्टेंट इज द ओवुलेशन नहीं हो पाएगा तो आपकी साइकिल नहीं हो पाएगी, रप्चर नहीं हो पाएगा. जब एग ही नहीं बनेगा तो आप कंसीव नहीं कर पाएंगे और आपके पीरियड या तो बहुत ज्यादा हो जाते हैं या बहुत कम हो जाते हैं. पेशेंट कैन हैव अ स्कैंटी पीरियड और समटाइम पेशेंट कैन हैव नो पीरियड एट ऑल. सो दिस इज द वे टू अंडरस्टैंड दिस थिंग.
Right. So, what are the most common symptoms? आपने दो तीन बताए, right? Like the thinning of the hair, and then you spoke of acne. What are the other symptoms basis which females can consult their doctor to find out if they actually have the disease? क्योंकि external symptoms से ही तो we find out कि हाँ, there's something wrong and we should actually go to a fertility expert or go to a gynecologist even if they're not considering having a child.
See, most of the young girls, what happen these days, are complaining of irregular cycles and gaining weight. So whenever you feel your cycles have become irregular, or there's obesity or gain of weight, acne, your doctor will prescribe you some tests to be done. The most important test will be the ultrasound. On the ultrasound, what you see your ovarian volume, what is the size of your ovaries, how many antral follicles. They got small cysts are formed in the ovaries, which can be seen on the ultrasound. So once the ultrasound is done, your doctors will come to know whether you have a PCOS syndrome or not. After that, फिर कुछ blood test होते हैं जो आपको बोलते हैं आपके डॉक्टर कराने के लिए, जिससे you have an idea कि what are the symptoms and how severity of the disease is there in you. Accordingly, you can be given some medications. So most important system will be your irregular cycle, for which you have to go to and consult a doctor, whether you are planning for a pregnancy or not planning for a pregnancy.
So basically what you're saying is कि apart from thinning of the hair, acne, weight gain, the cycle, the frequency of the cycle is also very, very important.
Because like abnormal menstruation is the most important. Irregular periods.
Periods.
And this is very common in young girls also nowadays, because it's mostly a lifestyle disorders which causes it. So a lot of junk food and everything. So most of the patients coming, whether not planning for conception also, they come because of the irregular cycles to us.
Right.